If you are over 50 and something feels wrong right now, a pain in your chest, a fever that will not break, dizziness out of nowhere, you are about to face one of the most important decisions you can make. Do you call 911, go to the ER, urgent care, or wait it out at home? Here is what I know as a nurse with years of clinical experience. Most people get this wrong, and after 50, getting it wrong has real consequences. Going to the ER when you did not need to, that is 4 hours of waiting, thousands of dollars in bills, and exposure to other people who are genuinely sick. But waiting at home when you absolutely should not have, I have seen that end very badly. Today, I am going to give you a complete decision framework. By the end of this video, you will know clearly and confidently exactly where to go for any symptom. No more guessing, no more expensive mistakes. I am going to share the same framework used in clinical practice, and I will give you a tool I call the 2-minute rule, a simple 3-question check you can do anywhere that tells you exactly what level of care you need. Stay with me. This one could genuinely save your life or the life of someone you love. Let us start with the most important category, the one where hesitating can be deadly. These are the symptoms that mean stop what you are doing and either call 911 or have someone drive you to the emergency room immediately. Number 1. Chest pain, pressure, or tightness, especially if it radiates to your arm, jaw, or back. After 50, this is a heart attack until proven otherwise. Do not drive yourself. Call 911. Number 2. Sudden shortness of breath, meaning you went from fine to struggling to breathe in a short period of time. Number 3. Stroke symptoms. Remember the acronym FAST. F is for face drooping. A is for arm weakness. S is for speech difficulty. T is for time. Time to call 911. If you or someone near you has even one of these, you do not wait. You act immediately. Number 4. Sudden severe headache. The worst headache of your life. That can signal a brain bleed. ER, not urgent care. Number 5. Loss of consciousness, even briefly. Number 6. Severe abdominal pain, doubled over, cannot stand up straight. Number 7. Fever over 103 with confusion, stiff neck, or a rash. That combination is a medical emergency. Here is my nurse's rule for the emergency room. If something feels suddenly and severely wrong, trust that feeling. A false alarm is always better than a missed emergency. One thing I recommend having at home, a pulse oximeter. It measures your oxygen level in seconds. I will link the one I recommend below. Now let us talk about urgent care. And I want to be honest with you. Urgent care is a place most adults over 50 underuse. It is faster than the ER, dramatically less expensive, and it handles a huge range of conditions very well. Go to urgent care when the situation needs attention today, but does not feel immediately life-threatening. Go to urgent care for fever between 101 and 103 degrees without the warning signs we just covered. Also, urinary tract infections. UTIs are extremely common after 50, especially in women, and they need to be treated. Left untreated, they can become kidney infections. Urgent care will test and prescribe same day. Urgent care is also right for dehydration symptoms, dizziness, dry mouth, dark urine, that are worsening despite drinking fluids. And moderate injuries, a fall, a sprain, a cut that might need stitches. If you fell and you are in pain but conscious and stable, urgent care can X-ray and treat you. Breathing issues that are uncomfortable but not severe, a bad cough, wheezing, or asthma symptoms not responding to your inhaler. Get to urgent care. Do not wait on that one. And any infection that is spreading, a wound getting red, warm, and swollen. Skin infections move fast. Urgent care can start antibiotics quickly. A blood pressure reading unusually high for you, something like 170 over 100, when you are feeling symptoms like headache or dizziness. Not necessarily an emergency, but get it evaluated today. By the way, if you do not have a home blood pressure monitor yet, after 50 this is non-negotiable. I will link what I use in the description. Okay, and this part matters just as much, because overreacting is also a problem. Spending 4 hours in an ER waiting room when you have a common cold? Exhausting, expensive, and you are exposed to genuinely sick people. Here is when you can stay home and monitor yourself safely. A mild fever under 101 degrees. Rest, fluids, monitor. If it climbs above 103 or you develop any warning signs, then you act. A cold or flu. Runny nose, body aches, mild fatigue. Rest, fluids, over-the-counter symptom relief. Your body knows how to handle this. Minor dehydration. You feel thirsty and a little off, but you are not confused or dizzy. Start drinking water with electrolytes slowly and reassess in an hour. A mild headache with no other symptoms. Take your usual pain reliever, rest, and see if it improves. Key word, mild. Not the worst headache of your life. Mild stomach upset. Nausea, a little loose stool, discomfort after eating. Monitor. Hydrate. If it gets significantly worse or lasts more than 24 to 48 hours, then get it checked. The key word across all of these stay-home situations is mild. Mild, familiar, and improving. The moment any of those three change, you move to the next level of care. Now, here is the most important thing I am going to say in this entire video. I call it the 2-minute rule. I want you to teach this to every person you love who is over 50. When something feels wrong, pause. Give yourself exactly 2 minutes to answer 3 questions. Question 1. Is this getting worse or better in the last 15 minutes? If it is getting worse, act now. Do not wait. Question 2. Have I ever felt this before? Familiar symptoms are usually less alarming. A new, sudden, severe symptom you have never felt before? That deserves immediate attention. Question 3. Would I be embarrassed to tell a nurse about this? If you would feel embarrassed saying, "I came in for this," it can probably wait. If you would feel worried telling a nurse about it, trust that feeling and go. 2 minutes, 3 questions. It is the fastest triage tool I know, and it works.